Here are 5 signs that your body might be telling you that you are hypothyroid. I'm Dr. Sidhu, and I am a family practice and a lifestyle medicine doctor. I'm also the proud founder of Spring Monarch Primary Care, which is a direct care practice here in Houston, Texas. I like to help patients feel better with practical, holistic, evidence-based tips. So if you want to learn more about practice, I've linked it in the captions below. Let's dig in. First of all, let's talk about what hypothyroidism is. Hypothyroidism is when your thyroid is low functioning. So it is not working the way it should, and it is working slower than it should. Our body uses thyroid for energy. So there is not a cell in your body that doesn't need the thyroid to function well. The thyroid can impact your vital signs, reproductive health, musculoskeletal health, your GI symptoms, your immune system, and all kinds of things. So when our thyroid is low functioning, we tend to not feel well. And oftentimes signs and symptoms our body is tell us that there's something going on with our thyroid. And here are some of the top 5 signs that I see in hypothyroidism. Now, as a doctor, I'm also a patient and I have had hypothyroidism. And the best way I can describe what hypothyroidism feels like is that it feels like your body is a marshmallow moving through jello. Now, if you are a thyroid patient and been hypothyroid, when I say a marshmallow moving through jello, it may feel like a light came on. Like, I can't think of a better description of how it feels. And if you've never had a thyroid problem, that may feel confusing, but just think about how it feels. Everything just feels harder and heavier. So when we break that down, what does that look like? So the number one symptom we see with hypothyroidism is fatigue, feeling tired. So oftentimes, even if patients sleep 7 to 8, 10 hours, they wake up not feeling rested. Most people, if they sit on the couch for a little while to get their energy back up, and then they can go and do what they need to do. But oftentimes hypothyroid patients, even when they sit for a while and they get up, they don't feel recovered and their energy isn't back. It's because their recovery is slower. So fatigue is one of the most common symptoms I see for hypothyroidism. Number 2, we see constipation. So we just talked about that our body uses the thyroid for energy and metabolism, and when the thyroid is low functioning, so is our gut motility. So food is moving through the stomach at a lower rate. We're drawing more fluid out of the intestines into the rest of the body, and that can cause constipation. The third thing I often see with hypothyroidism is weight gain. It's important to understand that when we talk about thyroid and weight gain, we're not talking about massive amounts of weight. We're talking about 10 to 12 pounds of weight. Some of that is due to the metabolism slowing down, and some of that is due to water retention. So if I have a patient that comes in that's had a recent weight gain and they really don't know why, then oftentimes I know that it's time to check their thyroid. The fourth thing is that I will often see with hypothyroid patients, particularly, of course, women in this case, would be menstrual problems. And the menstrual problems that we see with hypothyroidism, that it can cause longer, heavier, more painful periods. So if a patient has a change in their cycles and those cycles are becoming longer, heavier, and maybe more painful, sometimes I know that it's time to check their thyroid. The fifth thing that I see oftentimes with hypothyroid patients is mood changes, particularly depression symptoms. So oftentimes when patients come in with new onset of depression, that is an indication for us doctors to check their thyroid and make sure that this is not depression caused by an underlying condition versus just depression in isolation. So if someone comes in, their mood is low, they're not feeling motivated, and this is new for them, then doing their thyroid test is a good way to start before putting them on the antidepressants if we have time to wait based on their symptoms. So if you have these 5, either one or all of the symptoms, it may be time to talk to your doctor about thyroid. But how do you do that, right? It may feel like oftentimes thyroid symptoms are sort of brushed off. And I'll tell you what, feeling like the thyroid is dismissed is not all in your head, because up to 60% of thyroid conditions are actually undiagnosed. So 12% of Americans will develop some thyroid issues over a lifetime, and about 60% of those are undiagnosed. So if you feel like you've gone a long time, your thyroid hasn't been worked up, or you're being dismissed, it's not in your head. We're actually doing that in the American healthcare system, and we need to be better about it. So recognizing the symptoms yourself and then going to talk to your doctor is a good start. When you go to your doctor, they may decide to do blood tests, they may do a physical exam, and they may do an ultrasound, all depending on what your symptoms are. But with the blood test and with the clinical symptoms, we can correlate it all and decide if you need medication. And if you need medication, there's usually one standard, but there's various, and so your doctor can talk to you about which medication is best for you so that we can get you feeling better. All right, this is the top 5 things that I see with hypothyroidism. If you like this topic, please be sure to hit like. If you liked this type of format and you want to see more like this, please hit subscribe. And please share this with a friend who you think needs to hear more about their thyroid. And I will see you guys in the next one.